Well, Rodney, thank you very much. And I want to add my thanks to Women's College Hospital, Dr. Bray and the team there, and to our speakers, Dr. Havis, Dr. Davis, and Dr. Miller, for taking time out of their busy schedules. What I'd like to do is to talk and just give you a very brief overview of C4ST, Canadians for Safe Technology, just tell you what we're about. I think you should know that. We have the booth at the back, so I'm not going to be able to answer all your questions now. So if you have any other questions, please go and talk to the team. I want to talk about Safety Code 6. That is the guideline that the federal government sets that controls all of this wireless radiation and all these devices. And so I wanted to just give you a brief update about that. And I want to end with a letter that we wrote to the Health Minister, Ambrose, on our concerns about the process around Safety Code 6 and the actual status of Safety Code 6. So let me do that. I was asked during the break, who pays my salary? And I want to clarify. Yeah, right. So we are 100% a volunteer organization. So all the folks you see at the back are volunteer. They're young, running businesses. A lot of them. I have the benefit of I'm just taking away time from my retirement. Our daughters are older. You see, our volunteers are very young families running businesses, and they're still volunteer. We have some riding reps. We have 60 riding reps across the country whose role is to go and meet with their local member of parliament and update and introduce the topic to the member of parliament. We have now 60 riding reps across the country, and we've got 7 or 8 of them that are joining us today. So we are a nonprofit, volunteer-based national group. We have two missions really. One is to educate and inform Canadians and policymakers about the dangers of exposure to unsafe levels of radiation from wireless devices. The second goal is to work with all levels of government, so that includes municipal, provincial, and federal, to create healthier communities. 2 specific focus areas are, we spend probably about 80 to 85% of our time working with the federal government, lobbying the federal government, informing and educating the federal government, and trying to convince them to improve the transparency around the process around Safety Code 6, and then also to change Safety Code 6 and bring it into the 21st century. The second goal we have, and you've heard Dr. Havis talk about electrosensitivity, is to raise awareness about electrosensitivity, and our goal is to have the government formally recognize it, formally acknowledge it, and then, because when that happens, then the next question is, okay, now what are you going to do about it? So that's really the two main goals that we have in our environment. So let me just talk very briefly about Safety Code 6. It is the overriding guidelines. So it is set, to the earlier question, it is set by Health Canada. So Health Canada says the number is here that you're allowed, and it started in 1979, was the first publication. And what we point out to the government, it has not had a major change in all that time. Dr. Davis explained how this is done back in the early days, and it's done with some rats that got confused, and that's what we're basing it on. What's happened since then, though, is that it's now being used as the de facto standard by Industry Canada for any cell tower and cell tower antenna placements. Schools, when they roll it out on classrooms, Wi-Fi, it's realized Safety Code 6 is relied on. Smart meter installations, and any wireless device, whether it is a cell phone or a home portable phone, whether it's a baby monitor, games consoles, or wireless speakers, or wireless mice or keyboards, are all dependent on Safety Code 6. Health Canada has just finished an internal review of Safety Code 6 in 2013, and the Royal Society of Canada, and we'll talk about that, they did a quote independent review that was published on April Fool's Day of this year. Public input was closed on July 15th. It was the first time that Health Canada has actually asked for input on Safety Code 6. We felt that was a bit of a win for us. And published that say they're going to do the final review or final update of Safety Code 6 this fall. It has not been updated since 2009. So this is a pretty momentous time frame that whatever they decide to do could last for 3 or 4 or 5, even 5 years. Our concerns, and these are documents that we've written to Health Canada, and there's a lot more to talk about Safety Code 6. It is based on 6 minutes of exposure, and it's based on a computer model of a 200-pound male. And so, you can think of all the things that are wrong with that whole approach, right? I am from the computer business, and I sold a lot of software in my life, but it's only as good as the people writing it. And so I'd hate to risk my potential for brain cancer or breast cancer or the ability, I'm not worried about having children anymore, but a lot of you are. I'd hate to base that only on a computer model. Second point is there is absolutely no consideration for multi-hour, multi-day exposure that we have now that is standard procedure. There is no way that Canada, whether it's Industry Canada or Health Canada, tracks the cumulative effects. So if you're sitting in a classroom and you are near the router and it's a bring your own device day for school and you've got cell phones all around you, there is no tracking and measuring and monitoring of that cumulative exposure from all those devices. There is no distinction for pregnant people, for kids, for the elderly, or electrosensitive. Now, what we continually point out to the government is that Canada lags behind countries such as China, Russia, Italy, and Switzerland, who have guidelines 100 times safer than Canada's. And the other analysis that Deborah, one of our volunteers, did was that 40% of the world's population has guidelines better than Canada's. So this country of ours, this great country of ours, where we are leading in a lot of great things in terms of air pollution, in terms of acid rain, in terms of pesticide bans, we are behind I would argue, some of the laggards in air pollution on protecting ourselves from wireless radiation. And finally, and you've heard a little bit today about the core issue and the core debate around the science is that you heard about non-ionizing and ionizing. Well, ionizing radiation heats you up and it heats your body. And Health Canada is stuck in the 1979 approach and belief and statement that if it doesn't heat the tissue, it can't harm the tissue. And there are hundreds and actually thousands of studies now that show you don't need to heat tissue to harm it. Let me just end on and we can have time for questions in a minute, but over the last 18 months, we've really been on a campaign to pull together a lot of information. So in your package, there is the letter that we wrote to the minister. You can read at your leisure. But I just wanted to pull out 4 key points from it. We talked about the declaration. We've actually had a handful of MDs sign the declaration. So we had 40 MDs from across the country sign a document that we submitted to Health Canada by this July 15th deadline. Magna was very instrumental. Dr. Havas was very instrumental in helping us get 50 international scientists to write a declaration and sign it to send to Health Canada. And both groups said that the current level of Safety Code 6 does not protect Canadians. Absolutely, categorically, fully does not do that. We hired a small little research team. Health Canada has issued their draft of Safety Code 6 update. And so we had a team of people who are researchers, like formerly PhD, one is a PhD level in research, and had them go back and crawl through all of the reference material that Health Canada had published and the Royal Society had published in their review. And what we found, 140 studies that were ignored by Health Canada and that were not referenced by the Royal Society in this current update. And so we have submitted that to the government and say, we would like to know how you can possibly update Safety Code 6 when we, in our little team, have found 140 studies that show definitive harm to humans at levels below Safety Code 6. How can you possibly update Safety Code 6 when you've missed this core amount of scientific evidence? There was a brief discussion before about the Royal Society of Canada's independent review. When the panel was first announced a year and a half ago, C4ST wrote a letter to the minister saying this panel is conflicted. 4 of the 8 members of the panel had direct ties to industry. Now, the argument that you could make is to say in this field, you have to get funded. And we said, well, that's fine, but here you've got 4 people who have written papers who are on public record saying they don't believe there's harm. Where's the counterbalancing team of 3 or 4 or even 1 on this panel that believes there is harm? There wasn't. So there was no representation. So what they allowed us to do was to have nominate a peer reviewer to come in and peer review the report. And they actually had another peer reviewer whose name I won't mention, Anthony. No, it's in the public document, so I'm not telling any stories out of school. And so the process around a peer review is you get a draft copy of the document, and then you write a formal response to the society that's doing the analysis. and then they publish the document. And during that time that you're doing your analysis and you're doing your feedback is a confidential time, and you respect that process. And we respected it. As hard as it was because we really wanted to know what the report was going to say. When the report came out, and I think I can speak on behalf of both peer reviewers, they were very, I think, discouraged by the lack of attention that was done and the quality of the report. In fact, they're on record in public and with the press saying that the report failed in its obligation to the public. So we have gone back to Health Canada and saying, please, I hope you're not going to rely on this report that we identified 18 months ago was a conflicted panel. 2 of the peer reviewers that you asked to peer review have come out in public and said the panel didn't do their job. So we don't know if that's, but that again is part of our submission to Minister Ambrose saying as you're looking and working with your team on updating Safety Code 6, we think there's some fundamental problems on the process. The final point, and I don't know a lot about the international process and international best practices around scientific evidence review, but I have talked to several experts in this field. And one of them who's written a paper that's been published in the British Medical Journal told me that what he knows of the process, he would give Health Canada an F on their process. I said, oh, come on, I can't, at least a D. He said, no, Frank, it'd be an F. So we're trying to get that input into the minister to say, look, and the point that we met with some folks at the Ontario level yesterday, saying you just need to understand that you're relying on this Safety Code 6 and its process when you're rolling Wi-Fi out into schools and you're rolling smart meters out. And I think it behooves you, as a person relying on this process, to really ask some harder questions about what's exactly going on behind the process on updating Safety Code 6. So that's where we're spending our time and energy. It's that quality of input, it's that quality of analysis, it's that quality of feedback that we're trying to give to the federal government and the provincial governments that are relying on it in our efforts to raise awareness. This forum today is another opportunity for us to get our message out. We're going to ask during the panel discussion if you have some ideas or things you need from us that we can do. I will make a call out for any of you who are really jazzed up about this even more than before. We'll gladly take your name at the back at the C4ST booth to join the team and help us. The pay's terrible, but you have a lot of fun.